This is a brief summary of the research findings on the South African case study. The institution is the Cape Peninsula University of Technology, which offers vocational and professional programs in engineering, health and applied sciences, design, business, and education. The university is located on the Bellville campus in the heart of the Cape Flats, an area marked by poverty and all its related challenges. The focus of the case study is the Department of Medical Emergency Sciences, also known as paramedics. Most of the academic staff in the department are paramedics themselves. The Professional Council requires all paramedic teachers to undertake a formal qualification in post-secondary teaching and learning. The head of department was thus very supportive of the PG Cert. Around 2 staff members enrolled per year over a 5-year period. By now, almost the whole department, around 15 academics, have obtained the qualification. The questions that this case study seeks to address are, firstly, how are paramedic identities changed or affected by the PG Cert? Secondly, what were the processes of identity change and reformation? And thirdly, what kinds of teaching identity emerged? We draw on Margaret Archer's understanding of the interplay between structure, culture, and agency in the formation or continuation of agency. Before the PG Cert, teaching was more formal, both in the laboratory and in the classroom. There was a clear separation of paramedic theory and paramedic practice. There was a change in practice as more staff completed the PG Cert, from more lecture and instructional delivery to more active and engaged forms of teaching students. This is confirmed by the head of department, who says, "I think that problem-based learning is something that's come out, and now some of the lecturers are using that. And it's this that we're seeing. Constructivism coming in more, and e-learning with them using Blackboard and using that as a platform for tutorials. So these are some of the things I've seen as practices start to change." But what do these changed practices mean for the action man paramedic identity? Would too much critical reflection in the PG Cert make them go soft? Would they be able to train the next generation of mountain rescuers, of car crash medics, and general human lifesavers? We think there were 2 things that prevented PG Cert dominance. Firstly, there is some evidence that what Archer calls corporate agency has emerged. One of the participants claims that the fact that many of us have done the PG Cert means that when we entered the debates, we were all on the same page. We essentially knew what we needed to change in our practice, assessment, and in our thinking. If people were not on the same page, we would never have been able to develop as quickly as we did. So the fact that there were many paramedics on the program meant that there was a paramedic voice, not only an educational voice on the PG Cert, but also that there was an educational voice in the paramedic department. The second issue had to do with changes in the field. A participant explained that the move from teaching skills and skills based on very procedural types of approaches towards more critically reflective practice was similar to changes in the field of emergency medical science that required the reflective practitioner to make the kind of critical diagnosis and examination of the patient that required a little bit more in depth. So it seemed that the critically reflective approach that the PG CERT emphasized was well aligned with changes to the more critical approach of emergency medicine. A final word on the changing identity of the paramedic from the head of department. I think we try to create a culture that is aligned to the profession. So our students are in uniform, they're expected to stand when the lecturer comes into the classroom. You know, we have, like rescue is very regimental, but at the same time we try to say, well, you know, we want the participation, we want feedback, we want there to be discussion. So there's an interplay between those two roles, and I think the students initially find this to be challenging. In the same way, the PG CERT challenged but also enabled the paramedics to take on a more critically reflective identity, both in their teaching practice and in their practice of emergency medical care.